Good morning and welcome, everyone. We're here today, as you know, for the release of the Domicile Unknown report on people who died in 2024 while experiencing homelessness. I'm going to give you the run of show. We'll be hearing from Multnomah County Chair Jessica Vega-Peterson and then Dr. Emily Mositis, the County Health Department Epidemiologist Manager. Next will be Dr. Richard Bruno, the County Health Officer. Then it will be Street Roots Vendor Program Director Paul Susi, and finally, Central City Concerned Clinical Outreach Director Drew Grabham will provide some remarks, and then we'll take some questions. And I want to pause for a second just to thank and acknowledge the families of every single person counted in this report. I particularly want to thank the families who worked on the report and joined us in trying to make sense of all of this. Valerie Samuel, who spoke with us about her little brother, Tony Jamar Samuel. Rick Frank, who shared the story of his sister, Sammy Jo Misi, and Ben Donald Sizemore's brother, who wished to remain anonymous. And so thank you, and with that, I'll hand it over to Chair Vega-Peterson.
Thank you, Sarah. Good morning, everyone. Thank you so much for joining Multnomah County as we release this year's Domicile Unknown report for 2024. This is an important responsibility to our community to acknowledge, examine, and understand these largely preventable losses of life as we continue our work to address the conditions that contribute to the deaths of people experiencing homelessness. Before speaking to the what of the report, I want to first honor the how and express my appreciation to the County Health Department, particularly the staff in our medical examiner's office, our epidemiology team, and our health officer. I also want to thank our communications team for putting this together, especially Sarah Dean. Thank you so much. This report is more than just a rigorously researched document. It reflects a tremendous amount of care to capture and reflect these individuals' lives and experiences. It is countless hours of scene investigation, case review, conversations with families and loved ones, and data analysis. It is a lot to hold, and I am so grateful to our dedicated staff for their work to be thoughtful stewards of these tragic stories. I also want to acknowledge former Multnomah County Chair Deborah Kafori, who as a commissioner in 2010 championed the creation of this report, which the county has done every year since. I also want to thank the families and the loved ones who helped us anchor this data in the real lives of those we have lost in 2024. The fact remains that far too many people are dying while experiencing homelessness, reflecting the harsh conditions those living on the streets face every single day. Fentanyl in particular continues to devastate our community. While unacceptably high, the 18% decrease in deaths from 2023 to 2024 provides some hope that our investments to grow a continuum of homelessness and behavioral health services are making a difference and saving lives. And critically, it reflects the steadfast work we've done as a community to support housing and recovery services for thousands of people each year. I hope this downward trend signals that we've moved out of the toughest days of the fentanyl epidemic that we have worked so hard to respond to. We know the risk that our unhoused neighbors face, and this report should serve to galvanize our commitment to interventions that address those risks. Safe and stable housing and shelter with services attached, and increased access to behavioral and physical health care. We must continue to apply lessons learned and do all we can to ensure that the decrease that we're seeing this year is continued year after year. I know that my board colleagues share our commitment to building a strong system of care for people struggling with substance use disorder, irrespective of their housing status, but especially for those in the most vulnerable situations in our community. Multnomah County is committed to the work to continue this downward trend. With that, I will turn things over to the report's authors, starting with Dr. Emily Mositis.
Thank you, Chair. Hi, everyone. I'm Emily Mositis. I'm the Epidemiology Manager for Multnomah County Health Department. My team, the Community Epidemiology Services team, produces the Domicile Unknown report each year to understand the causes of death among our community members who died without a home. The numbers in this report represent the tragic loss of life at an intersection of factors, most of which are preventable. Each data point that I'll talk about here represents a person that our community has lost. For 2024, this included 372 people who died while experiencing homelessness in Multnomah County. For the past 3 years in this report, we have been able to compile data from both medical examiner investigations and from death certificates that were overseen by healthcare providers. The most recent year that we have finalized data from is 2024, which is represented in the report that we released today. Fortunately, the 372 deaths in 2024 represent a decline from the 456 deaths in 2023, which was the highest number of deaths since the report began in 2011. However, the deaths in 2024 still are the highest since 2011, except for 2023. The majority of people who died while experiencing homelessness were reported to be male between the ages of 35 and 44. The majority were white, but as a result of social and structural determinants related to housing and health, there was an overrepresentation of Black and African American and American Indian and Alaska Native people among those who died. The largest category of causes of death in 2024 was unintentional injury, which includes overdose. In 2023, we had seen the peak in overdose deaths among people experiencing homelessness, with 282 deaths. Although the number decreased in 2024, there were still 214 deaths due to overdose. Unintentional injury also includes traffic fatalities. There were 3 fewer traffic fatalities identified in 2024 for a total of 19 deaths compared to 2023 where there were 22 deaths. The majority of these were among pedestrians and cyclists. The leading causes of death among those deaths that were overseen by medical providers were cancer and heart disease, which are the same 2 leading causes of death for our county overall. Homelessness itself has continued to rise over time, which is especially apparent as the Multnomah County Homeless Services Department continues to gather more complete, in-depth data. The data that we provide shows the risks associated with homelessness. We see that overall the risk of death due to any cause is 6 times higher for people experiencing homelessness in Multnomah County than the general population. Each year we are grateful to have the opportunity to share this information to help inspire community action and guide the work of the county to prevent these deaths. Now I'm going to hand it off to Dr. Bruno, the Multnomah County Health Officer.
Thanks so much, Dr. Messitis, and thanks to Jamie Walters for their work putting this report together, and to the wonderful team of medical death investigators who did a lot of the investigations of these folks when they died. I want to point out a few trends that Dr. Messitis mentioned that kind of mirror national trends in terms of deaths by people experiencing homelessness. Those really include higher risk of death among those who are male, age 35 to 44, and those who have disabilities. And there's also similar drivers that are unintentional injury, mostly from substance use and traffic fatalities, as well as chronic diseases like cancer and heart disease. It's worth highlighting that in 2024, we saw an 18% reduction in those people experiencing homelessness deaths and from the year before. And some of those can be attributed to decreased deaths from substance use and traffic fatalities and gun homicides. And because those overdose deaths decreased from 282 to 214 last year, we wanted to look at what was really driving those overdoses. And the majority of those overdose deaths, folks had used both fentanyl and methamphetamines. So we figured those are 2 of the largest contributors to those overdoses, and continue to inform the need for dual diagnosis treatments. And although we've seen some delays in the past for toxicology results, we're placing new pilots in place to create faster workflows in our medical examiner's office and to be able to identify those more quickly and be able to assign those deaths and bring closure to those family members of those who've died. The traffic fatalities, those folks who had experienced homelessness had a 54 times greater risk of death from traffic fatalities than the general population. And that was especially true during times of low light, like before dawn and after dusk. Those people were dying simply trying to exist and navigate within our county. So we're really working on more coordinated urban planning interventions with our transportation partners to ensure that we can continue to see decreased traffic fatalities next year. Early evidence suggests that these interventions are working. I'll highlight 5 main programs that have shown promising results since 2024. The first was the 90-day fentanyl emergency declaration that happened between February and April of last year that really set into place a lot of interagency collaboration and coordination, sharing data and presenting those data publicly. So you can still go to our website and see our fentanyl overdose dashboard, which has information from 5 different agencies showing those trends and how they've been improving over the last 2 years. Next is the overdose prevention and response plan that the health department released, which really highlighted prevention, harm reduction, treatment, and recovery options for people with substance use disorder. We distributed 50,000 doses of naloxone last year and expanded our medication for opioid use disorder options in our clinics and our jails, including long-acting injectable buprenorphine, which helps support people for a month at a time. Next was the Homeless Response Action Plan, the HRAP, which really coordinated a strategic attempt to improve our region's housing stability. We've recognized over 10,000 folks being able to access shelter and over 6,000 folks being able to leave homelessness for housing. Over 1,000 shelter beds coming online, more site acquisition, as well as improving the services available at those shelters to bridge to longer-term housing. And the goal is really to also prevent hospital and jail discharges to the street. Next was the Pathway Center for Deflection, and it's also a place where people got needed services and got connected to care over the last year and a half. Over 400 people have engaged in services since it's opened, and over half of those clients served reported being unsheltered at the time of service, with top referrals going to substance use disorder treatment and housing. And lastly, I want to highlight the mobile van services that expanded under the funding from House Bill 4052, which really attempt to provide low barrier access to medical, dental, substance use, and wound care services in the field, and really help avoid downstream ER visits and hospitalizations. And many of the van services that have opened include our county vans and our partners like Central City Concern, Cascadia, New Season Methadone Clinic, among many others. I just want to say, as a family physician who's cared for many of the folks who experience houselessness, each of the 372 folks that we discuss in this report have separate stories and have separate reasons that brought them to early mortality. But we're really grateful that the families of Tony and Sammy and Ben were willing to give their insights into their lives and the situations that led to their early deaths. Because the average life expectancy among those who died in 2024 who were experiencing homelessness was 46, which is nearly 30 years earlier than the general population. As Dr. Masitis mentioned, someone who's experiencing homelessness has a 6 times increased mortality rate. And so we can call houselessness a major medical condition. I want to encourage us not to be indifferent to these numbers. Indifference is really not an option. We really must explicitly work to prevent these deaths in our communities. And I'm really happy to have our Street Roots partner, Paul Soucy, to give us a little more on some of that work that they're doing.
Thank you. Good morning. My name is Paul Soucy. I use he, him pronouns. I am the director of the vendor program at Street Roots. For folks who don't know, Street Roots is an award-winning, independent, investigative weekly newspaper sold by folks experiencing poverty and homelessness in Portland and in the whole county. I'm here to express our appreciation to the county and to the larger community for our collective commitment to rigorous and transparent data. Street Roots vendors and advocates were among the loudest and most persistent voices encouraging the county to release this data on a regular basis for the first time in 2010, 2011, as the others referenced. I want to underscore here that this important work captures specific data, and it's critical to have that information as we collectively make decisions for the health and safety of our larger communities. But this data masks the real stories and identities of the people that they represent. And this data exists in a really specific moment in time that doesn't keep up with current circumstances. Since I joined Street Roots as vendor program director in July of this year, I have witnessed 6 deaths in our community of vendors. Some were folks living in supportive housing or hospice programs. Some were living in the tents and sleeping bags that are so conspicuously intolerable to so many members of our community. Just yesterday, we hosted a memorial service at Street Roots for 2 trans individuals who passed from overdose. A 3rd member of that small family survived the same substances and came to us to hold a memorial space for them, since no one else in the community would do so. Another person was a longtime vendor and board member of Street Roots, formerly homeless, and her passing has deeply rocked her family, her community of neighbors and customers at PSU's Saturday farmers market, and her own faith community. I mention these small, localized anecdotes because homelessness is not tents, it's not garbage, it's not needles on the ground or sleeping bags in your doorways. These are human beings. We are human beings with dignity, love, histories, communal and familial ties amongst all of us. You can't simply warehouse people against their will and withhold tents and sleeping bags and thereby assume that the problem is going away. We are your family members, your students, your neighbors, your elders. We share your faiths and your dreams, your disciplines and your accomplishments. If this data indicates anything, it's that our community's significant investments over the last several years are now beginning to make a difference in the lethality of living on the streets of Portland. Speaking as a former homeless shelter manager myself, I can with confidence say that what we truly need are more supportive housing programs, more peer support and outreach programs, and yes, more tents and more sleeping bags. These clearly do more to keep people alive than simply trashing everyone's belongings and shuffling people from one undesired location to another and issuing $100 citations that no one can afford to pay. Please, everyone, please review this data carefully. Please consider yourself in this data, your loved ones, your family members, you. If you lost everything and had to survive outside, what are the programs and resources that you would seek? And how long would you last until you became another statistic? I'm going to turn it over now to my friend and colleague, Drew Grabham. Thank you.
Thank you, Paul. That is a hard one to follow at times. My name is Drew Grabham. I work at Central City Concern. I'm our director of our outreach services. Central City is a very large nonprofit that provides medical care, behavioral health care, housing, and employment services. And I'm here to sort of echo what Paul said about the 372 lives that were impacted. That was someone's loved one, neighbor, son, daughter, mother, friend, or colleague. And we're here to grieve them. About 10 organizations. I guess I'm here to talk about the Homeless Day of Remembrance event, which is on the longest night of the year, which is December 21st. So Multnomah County and several other counties around Portland and around the nation are hosting a little memorial event. So on this Sunday, December 21st at 5 p.m. at St. Andres Basset. We will be gathering together as a community and reading off some of the names and talking about some of the stories of some of our loved ones that came around. Everyone is invited to come or to gather names to be shared there. We find it really important to come together as a community to sort of remember our friends, remember and laugh together about the funny things that they did and grieve the loss of these folks, and to continue to say their names so that we remember how important they were to our community. We're also coming because some of us providers need to mourn and grieve and care for ourselves. So this is a part of our own self-care that we do, and we're really honored to come together. There's 10 organizations that have put this together on. We will have singing and dance and food and other gatherings together. So if you would like to come, please join us. And if you don't want to join there, I do encourage everyone to just take time to read this report, think about the families and the community that was lost, and remember that each one of those humans' lives is super important to us. I wanted to share, I have a lot of street outreach teams that are out in the street every day. We had a memorial event for ourselves yesterday, so there's 10 of us, and we just listed off 20 folks that we have lost in this past year, and the team was really sad about that. Some to overdose, some to cancer, some to traffic fatalities. So these are real people in our community that are passing away, and our staff was able to take time together to really remember them, laugh, and cry. And I was so grateful that we just had that time together, and we're really honored to know these folks. And we look forward to next year having an even less dent of where it is. I want to leave you with that last statistic of being houselessness. You have a greater risk of 6 times of causing death. That is a huge thing that we can overcome. And we're super grateful for this decrease in these deaths. And what I want to call and say is I agree, like what we're doing, this investment that we've made in supported housing services, in outreach, in medical care is starting to show. So now's the time to lean in and continue to let these systems build up so that we can care for all of our Multnomah County residents and folks that we care about. Thank you.
And with that, we'll take questions. Lily.
I have one really small question. Can you confirm that nobody died in 2024 of the elements? It didn't mention hypothermia or hyperthermia in the report.
Yeah, thanks for that question. So we didn't identify any deaths related to heat. We did identify a death related to cold, but it's not written into the report because it's a single death, and
Okay.
we don't report below 3.
Makes sense. Thank you. That's why I was hesitant, just because it wasn't there to say it hadn't
Right.
happened, because I did. So thank you.
Yep,
So in 2024, 1 death related to cold, none related to heat.
that's right.
Okay, thank you. Can I ask a second question?
Yeah. For Emily?
For
Okay.
the room.
We'll see.
I guess you guys are talking about seeing the investment pay off, and that's great. And we all know that we're facing like a serious budget crunch coming up here. Some of it is state, some of it is local, and a lot of it is the federal changes. So can anybody speak to how you're expecting those changes to affect the investments that have been made so far and the system that has been set up?
Do you want me to take that?
Sure.
Yeah. So that is the, $100 million question that we're all grappling with, especially in light of not just our local budget impacts or our state budget impacts, but what we're seeing at the federal level and the change in policies there, like the change in expectations for continuum of care dollars that fund so much permanent supportive housing and permanent housing here in our region, and change in policies to go to transitional recovery are going to have a deep, deep impact on the number of people that are housed in our community, permanently housed in our community. We don't want to see, and what would be so devastating is to see those people who have moved from homelessness into permanent housing lose that housing because of a change in federal policy. So we are working on that. There are no easy answers when we're looking at like such a constrained environment and changing of our resources, but we are working together to address that. So just earlier this morning, I had a meeting with a table that I've been convening over the last few months with leadership from Home Forward and Care Oregon and HealthShare, county leadership for Multnomah and Washington counties, the mayor's office, the Metro president was there, right? So we are talking about all of these different impacts that are coming down on us and how we can best align for mitigating those collective impacts and trying to do the best we can. So those conversations are going to be helpful as we go down to the legislature in the short session, as we're taking a look at our individual budgets as local governments and local entities, and really trying to figure out how we can best address some of these impacts to have the minimum effect on the community as possible. We know that it is almost impossible to say that there aren't going to be impacts, because we know that there are. A local or even a state government is not going to be able to fill the gaps at the federal level, but what we can do is try to be working together in partnership to try to figure out how we can best use our resources that we do have for our community here.
Jeremiah.
Yeah, there's a pretty clear difference between the sort of political approach to addressing homelessness and the public health way of addressing homelessness. I'm sort of curious to hear about, we talk a lot about the public health approach through this work, talking about overdoses and explosive elements and stuff. But I'm curious, like, what do you think that the public, the voters, misunderstand about homelessness when it comes to sort of this public health approach to it? It's a big question, but
Yeah, thanks, Jeremiah. I think one of the things that I think is really challenging for folks is sort of the back and forth nature that homelessness can have on a person. A lot of times people will, get services for a little while, and then lose those services, or step away from those services and then kind of go back into services. So there's a lot of kind of in and outs that happen along that healthcare continuum and the housing continuum. So I think it's a challenging thing to kind of convey to the public, because it's hard to not only collect that data and analyze that data, but also be able to apply the results of those analyses to better interventions and better opportunities for folks. But I will say that with the overarching goal of getting folks into housing, off of the street, into some sort of shelter, transitional housing, longer term housing, people can kind of bounce between those a few times before they can kind of get stabilized, and then but once we can when someone does get a roof over their head that is stable, that's oftentimes where we can do a lot of the magic, which is providing additional services, whether it's substance use disorder, chronic disease, wound care, all the things that people may have deprioritized when they were kind of without housing. Once people can get that stabilization in place, it affords the ability to do a lot more public health work. So it's all hand in hand. It's all part of the more collaborative, kind of creative way we have to come together as multiple agencies, multiple community-based organizations, and across society to all kind of work together on this. Thanks.
For likely one of the doctors, I think, in this question. Obviously, we're looking to finalize 2024 data here, but Dr. Greer, for example, you mentioned the fentanyl emergency, which was 2025, and the kind of lingering effects, or when we're looking at things like that. Could either of you speak to what you are seeing in terms of trends or takeaways into this calendar year, even though the data is not finalized? What is this overarching message looks like as we go from what is finalized, what we know, to the last 12 months into the future?
And those sentinel emergencies, right? 23.
24. Yeah. Yes, absolutely. So the finalized data that we have available ended for the calendar year 2024. That data takes, those deaths take time to finalize in terms of the investigations, receiving toxicology reports, and then our team does a really deep dive to understand the housing status for everybody that might have been experiencing homelessness. So that all takes time, which is why we don't have more recent data. We do have much more up-to-date data on overdose. We have a suspected overdose dashboard that you can find on the county website that's not specific to people experiencing homelessness. So the reason we're not able to see those trends for this year is because of that in-depth look into housing status specifically. So that prevents us from getting very recent data. But yeah, that specific overdose data is available online on the fentanyl dashboard. But Dr. Bordeaux, do you want to add anything?
Yeah, and if you pull that data up today, you can see, you can compare 22, 23, 24, 25, those 4-year period that the dashboard includes. it really looks like 23 was kind of the peak. 24 and 25 have been decreased overdoses. It's a welcome trend, obviously. And so we think that will also kind of translate to decreased mortality, but we'll have to wait till next year to have that report.
Yeah, and I guess that's exactly kind of what I'm asking here. Even though it's not finalized this year,
Right.
what would be your expectations as you're following the lines, things that are not reported in this report? What would you look to see? What kind of things are you looking for specifically when it comes to this?
Yeah, I mean, we are hoping that a lot of the interventions we've mentioned today continue to do that good work, that we continue to see decreased overdoses, decreased deaths, and decreased trends overall, improving the state of folks who are houseless. I mean, obviously, we want to get to zero. That's the goal, that nobody who's houseless dies
And
early
you feel that
deaths.
what you haven't finalized in reporting for this year, but that it is going in that direction from what you can see, is that fair?
By simply looking at the overdose deaths, yes, that what we predict. But we have to do that deep dive that Dr. Messitis mentioned to get kind of the finalized report.
And the fentanyl state of emergency was in 2024, so it was during this time. Yeah. Louine, did you have a
Sorry, it was when?
2024?
Okay.
Yeah.
I did have another question. When you, what am I trying to ask? How do you go about figuring out who you have found who has died on the street? So like, what is that process, and how do you contact next of kin, and like, just what does that investigation look like? And are there, I guess, one additional question, are there people that died in 2024 for whom you don't have a name?
I can answer part of that.
Okay.
So in terms of how we determine housing status, we have two sources of data that we compile into this report. One is medical examiner investigation data. The other is vital records data, so death certificates that are overseen by a healthcare provider. Medical examiner data does go into death certificate data eventually and gets finalized in that way, but we lean on medical examiner investigation data because it's a really rich source of information, and our analyst digs into the narrative from those investigations to understand if someone appears to have been experiencing homelessness, that it's also part of the investigation itself. So there's a lot of rich data there to assess housing status. And then we have a second person, we have at least two people take a look and see if they agree on the housing status of the person. So that's what we're able to do with medical examiner investigation data, which is the majority of deaths that we look into. When we're looking at death certificate data, there is a field for indicating whether or not this person was experiencing homelessness. That is filled out often by funeral homes. So we don't have as much data to evaluate ourselves for that. We just need to go based off of what is written in that. So we consider the medical examiner data to be a really gold standard source of information that we're able to assess ourselves. And then we're very grateful to have the death certificate data as an additional source to give us the fuller picture of what's happening beyond what happens in under the jurisdiction of the medical examiner. So there were other parts of that question that I'll...
Well, specifically the names, I'm wondering how you determine, I know there aren't names in the report, but do you have a name for everybody who died in 2024, or are there some John and Jane Does?
It's a great question. I'll turn to our Chief Medical Legal Death Investigator, Kim, who's behind you. Do you remember, were there any folks that we didn't have names for that died in 2024 that were domicile unknown?
First, for unidentified individuals, sorry.
You can come up.
Come on, you're welcome.
Sorry, Kim.
Kim did
Thanks for being here.
Say your name and your title.
Hi, Kimberly DeLeo, Chief Medical Legal Death Investigator for Multnomah County. For any unidentified individuals, casework located, we would first work to confirm identity, and then we would work to develop a housing status once we had a name.
Great. So did you find a name for everybody, or are there some that you were unable to?
We do have a couple of cases that remain unidentified, and typically how we work those cases, we would reach out first to missing persons to develop a possible list of individuals who may be missing. Beyond that, we would then do likely a composite sketch if that was an option, depending on the condition of the decedent. And that would be in the form of a press release with details soliciting information from the public to help assist with identity. And then beyond that, we would be looking at DNA testing.
Thank you very much.
Sure.
I think that is everything. Thank you, everybody, for coming. If you have any follow-up questions, you can send them via email to pressoffice@moltco.us. Thank you.